because they've got
District court budget hearing.
Yeah, see, I'm not following this.
Interesting.
Beth, smile.
In your budget book.
Oh, she's got one in the morning.
In your budget book.
Oh, I've been reading my budget book every spare minute. More questions than there are answers, I'm sure.
September.
September 1st.
Chuck, I got your message last night. We'll call you today after I talk to Dean, okay? Always happy when people find money.
No. Opening ceremonies.
It's hard to tell, but yeah, we'll call you today.
Because they want me to crank up. Don't be joking.
He's looking sick.
Still missing one, so. 1 minute. Good morning, everyone. Welcome to the Grand Traverse County Board of Commissioners Public Health and Safety Committee. We'll start this morning by rising for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Bonnie, will you call the roll, please?
Commissioner Fleece,
Present.
Max Bauer,
Here?
Thomas,
Here.
Richardson,
Here.
Stepka,
Here.
Friend,
Here.
Inman,
Here.
Hooper, Wheelock.
Yes, ma'am. All right, the next order of business is the approval of the minutes of the August 4th committee meeting.
So move.
Support.
Motion by Richardson, supported by Friend, to approve the August 4th minutes of the Public Health and Safety Committee. Any further discussion? All those in favor say aye.
Aye.
Opposed, the same. Motion carries. This is our first opportunity for public comment. There will be one later in the agenda. Is there anyone wishing to make public comment at this time?
Fred Kiesler, Grand Traverse County Health Department. I just wanted to remind folks is that this afternoon at 4:30 is the grand opening of the K-Town Clinic in Kingsley for Adolescent Health Clinic, and certainly everyone is welcome, particularly Commissioner Fleece, who helped support that clinic. And we're going to have the ceremonies be at the village office or outside if the weather permits. Thank you.
Thank you, Fred. Is there anyone else wishing to make comment at this time? Seeing none, we'll move forward with the approval of the agenda. Are there any additions?
Move to approve the agenda as presented.
Support.
Motion by Inman, supported by Fleece, to approve the agenda as provided. Any further discussion? Those in favor say aye.
Aye.
Opposed, the same. No special orders of business. That brings us to the consent calendar. If you would, please, Bonnie.
The purpose of the consent calendar is to expedite business by grouping non-controversial items together to be dealt with by one commission motion without discussion. Any member of the commission, staff, or the public may ask that any item on the consent calendar be removed therefrom and placed elsewhere on the agenda for full discussion. Such requests will be automatically respected. If any item is not removed from the consent calendar, the action noted, receive and file or approval, is approved by a single committee action adopting the consent calendar. A, receive and file. Number 1, 13th Circuit Community Corrections Report for July 2010. 2, prison commitment rate. 3, this, which is Transition House, PRS, Probation Residential Services, and TAS, Traverse Area Support Services reports. 4, Veteran Services Activity Report through July 2010. 5, Veteran Services Draft Minutes of August 19, 2010. 6, Health Department Report January through July 2010 data. 7, Commission on Aging Report. 8, Commission on Aging Committee's minutes for August. Finance, Program, Community Relations, Endowment, Executive. B, approval. 1, surplus vehicles, Sheriff's Office. 2, Veterans Affairs, Leelanau County Agreement for Services. 3, fiscal year 2009-2010, Michigan Department of Community Health, CPBC Amendment Number 4. 4, lease agreement for Kingsley Adolescent Health Center. 5, medical directive services agreement with Benzie Leelanau District Health Department. 6, State of Michigan e-grants.
Is there anyone in the public wishing to have any of these items pulled? Anyone on the board? Larry?
Number 2, Veterans Affair under B.
Ross?
And number 6 under receive and file.
Anything else?
Motion to approve the consent calendar as amended.
Second.
Motion by Friend, supported by Inman to approve the consent calendar with the exceptions of A6 and B2. Further discussion? All those in favor say aye.
Aye.
We need a roll
Opposed,
call on
say-
the consent.
Oh, I'm sorry, we
That's
do
okay.
roll call that.
Early in the morning.
Trying to get done here. Roll call, please.
Max Bauer,
Yes.
Thomas.
Yep.
Richardson,
Yes.
Stefka,
Yes.
Friend,
Yes.
Inman,
Yes.
Hooper,
Yes.
Fleece,
Yes.
Wheelock.
Yes, ma'am. Okay, that brings us to action items. We'll deal with the Sheriff's Office first. Request to purchase antennas.
Morning, I'm Nate Elger from the Sheriff's Office. We're requesting to purchase antennas for our mobile data terminals. If you recall, this is part of the transition to the new software through New World and improving our ability to view reports and recognizing the full systematic functions of that software. The antennas that we originally were going to purchase do not have the ability to locate the vehicles through GPS. I'm sorry, the air cars did not have the ability to locate the vehicles through GPS. So we wanted to have that function as well as boost the signal strength for those mobile data, the cards. So Captain Emerson worked with Jason Torrey at Central Dispatch, identified this antenna as the antenna that we would like to purchase. They are $310 a piece, and during discussions about the software, we spoke about using forfeiture funds for the purchase of the air cards as well as the antennas if need be. So we would like to purchase those with the forfeiture funds.
Mr. Commissioner, or Chairman?
Mr. Hooper.
Yeah, I would move that Grand Traverse County approve the expenditure of forfeiture funds in the amount of $14,570 to purchase 47 antennas at the cost of $3,010 each. $310 each.
Motion by Hooper, supported by Fleece, to use forfeiture funds for this purchase. Comments? Dennis?
I just wanted to ask Nate. Nate, I assume that we can take these antennas and move them from vehicle to vehicle when we replace vehicles?
That is correct.
Larry?
So, if, on these wireless, going to wireless, so are you going to like connect to all the current towers that you're using for your radio frequencies to pull the data off your system? Is that how that's going to work, or?
In terms of getting rid of the old equipment,
Retrieving information off the mobile data terminals, if you go wireless, how's that work?
it's through the air cards, wireless air cards through the satellites, or the phone system, I'm sorry.
Oh, the phone system?
Yes.
Okay, I'm following.
AT&T.
You go through AT&T?
Yes.
All right, okay. So the wireless just hooks you up to a modem, just connects to a modem, and then you
That's
automatically get it out? Okay, all right.
We do not yet know how we're going to take out our old modems out of the vehicles and decommission those modems, and that's the stuff that has the towers on the equipment on the
Okay.
towers, so we don't know yet how we're going to do that.
All right,
But they are going to be obsolete in the next year.
All right, so there's, technically, would there be any blank spots in the county that you would be able to acquire that information because you can't get a signal?
Not with the antennas.
Not with the antennas?
Yeah, we have done studies with the air cards in this antenna, and it works perfectly.
Okay, all right.
There will most likely be a lot less dead spots than there are with the current radio
Yeah.
system.
Right, okay.
Any further discussion? You know, I think one thing that we probably could mention here is the fact that a lot of the antenna system that's part of our 911 system is getting very aged and needs a lot of updates. So if we can eliminate the use of that by things like this, I think that's going to help us long-term and the cost of maintaining our antenna system also.
Yeah.
Okay. Motion made and seconded. All those in favor say aye.
Aye.
Opposed, the same. Motion carried.
I do have one other point, reference the air cards. We talked additionally about the cost of these air cards. We have learned there is not an upfront cost for this air card, but it is a $40 a month service fee. The sheriff stated that we could use the forfeiture fund for 3 years to service that, pay for the service. How does this board want to go about that? Can we get approval now for use of those funds, for the forfeiture funds, and fund that for 3 years?
Do you have the air cards in now? Nate?
Some of them. The problem is that it is a $40 a month fee, and we're not going to be up and running live with the new world until probably January or February.
So my suggestion would be that we'll just amend the budget during budget hearing, and Dean will add in a revenue from your forfeiture fund in the same amount, and add that to the contractual line item so you can pay it, okay?
I thought we'd already approved that when we approved the...
I think you approved the
purchase.
concept of it, but now it's a monthly fee, and so
Okay.
that's the
Yeah.
thing that Nate's talking
I
about.
did go back and look through the minutes, and I couldn't find an actual approval.
It doesn't matter.
Okay.
Nate, let's just make
I
sure...
know the discussion was had for sure.
When we have the budget discussions, there'll be lots that goes on there. We got to make sure we get this line item changed, so if you'll help me do that,
Understood.
we'll do that.
Thank you very much.
Thank you, Nate. First item pulled from the consent calendar was the Health Department report.
Good morning again. Fred Kiesler, Health Officer, Grand Traverse County Health Department.
Morning, Fred. I just had questions about the immunization data. It's page 34 of our packet. And especially starting in February, it seems like there's a pretty healthy increase in the number of immunizations, well, especially February, March, and April. Is that mostly due to H1N1, or?
No, the external clinics were not included in that. There could have been some that snuck in there when people got multiple vaccinations. What we did is we had that immunization station open at the mall.
Yes.
And we did a number of seniors for the immunization for shingles and other immunizations. And also we had sports physicals at our adolescent health clinic. And we got kids caught up on their immunizations there. And as you know, as our WIC numbers are up, and we do try to immunize as many children when they come in for their WIC services. We try to integrate those services. So as the WIC load goes up, then we're going to see our immunizations hopefully follow.
Okay. Great.
I have one
further
question.
questions?
I have one question.
Larry.
Status of flu shots coming up?
That should be coming out in around October, and it will include H1N1 in the mix this season. We have been to the immunization station up through December. We'll probably be doing most of our vaccinations there rather than having set in multiple locations, and people seem to like that location.
So you're going to have is it going to be something similar, a big public type process where you have a number of locations and large groups, or is it, and you first, take care of the elderly and the risk?
Right, but
Situation.
we may try to divert as many as we can to that location because it'll be cheaper. I mean, we're in the scale of economy. There may be some done for the senior centers and so forth, that we haven't gone through the final plan yet.
Okay.
So Fred, the H1N1 piece of that will be part of the flu vaccine.
Right, when you get the flu
It won't be
vaccine, you'll get
separate.
H1N1 in with that.
Motion to receive and file the Health Department report.
Support.
Motion by Friend, supported by Hooper. Further discussion? All those in favor say aye.
Aye.
Opposed, the same. Motion carries. Next, we have the Veterans Affairs Leelanau County Agreement for Service. Page 73 in your packet.
The reason I
Morning.
asked this to be pulled is I have a concern involving the Leelanau agreement with Mr. Cooney's interpretations of the statutes. It says here, under 35.621, regarding appointments to a County Veterans Affairs Committee, the department shall be under the administration of a committee of 3 to 5 veterans appointed by the Board of Commissioners who shall be residents of the county and who have served honorably in the active duty of the United States Armed Forces. And then it continues. The question I have is, the way I would interpret this, and I'm not an attorney, but I don't see why Leelanau County would want to continue to be part of our organization and pay us $36,000+ a year for Veterans Affairs services with absolutely no representation on the board and as a voting member. My interpretation would be the Grand Traverse could have 3 to 5 members, and so could Leelanau County, because they're their own separate entity. But Cooney says we have to exclude them completely, and I don't agree with that. And like I said, we've been out looking to see if we could entice some other counties to come under Chuck's services there on Lafreniere, and this would shoot that right in the heel. I mean, common sense. In fact, Leelanau, upon reading this, may say, we're not going to participate. So I think we need to study this further or investigate his findings further, because we have 2 counties here, not one. And they're their own county in their own right with veterans.
I can address that to a certain extent, if you'd like me to. Mr. Cooney isn't here. I have 2009's agreement, and this is the agreement that we started with in 1996, and we've just renewed it each year. The old agreement, Commissioner Fleece, had a provision or a clause for joint committee and reciprocal membership. And that is what allowed Leelanau County to appoint a representative that otherwise met the qualifications within the law to our committee as we provided them services under contract. This year, Mr. Cooney, changed that major part of it right there and removed the reciprocal membership agreement portion of it for the reasons that he detailed in his memorandum to you. Again, I'm not an attorney either, but I've had preliminary discussions with Eric Klein, the administrator in Leelanau County. This does allow for them to have a liaison that they can appoint. The way Mr. Cooney explained it to me was they're essentially buying services from us, and it's a package. It's a package deal as detailed within the contract. This threw me a little bit too, because we've been using the same agreement for 15+ years. It's our 16th year, and as soon as it gets through our committee and our board, it will head out to Leelanau, and they may or may not be fine with appointing an otherwise qualified liaison to our committee. And whether or not they consider that representation, For voting purposes, I have to agree with Commissioner Fleece. They will have no voting privileges under the new contract.
Dennis?
I understand Commissioner Fleece's concern, and if I was in Leelanau County, I'd share that. I think, based on what I read here, it looks to me that they would have the option of establishing their own Veterans Board, which unfortunately means another board for Chuck to deal with, but they could establish their own to administer the contract that they have with Grand Traverse County. And that would be one solution. Although I think you're right, a better solution would be allowed to have those members of the two counties talk together and work together. But a suggestion might be, if you agree with Commissioner Fleece, that we could go that route, approve the agreement, they could set up their own board, and then we could ask Mr. Cooney to draft either to give us a mechanism to allow combinations of multiple counties, because we do talk with other counties about providing services, or draft legislation to allow that to be amended to have multi-county boards, which would seem to be the most logical way to approach this for the long term, because I can only see this happening more and more as dollars get tighter, regionalizing these services. So that would be my suggestion.
Larry?
I think that Commissioner Fleece has got a point here, and I think it's worth discussing with Bob at another meeting, because, we do have other relationships that within the county, that we have multi-county relationships that board members are allowed to serve on, like the Community Corrections Board, the Airport Board, the Council of Governments Board. I mean, there's all kinds of examples where we have relationships with other counties, and other counties have memberships on the steering committee or policy-making board. So I don't know what makes the veterans situation anything different than what we have with other established boards that we have relationships with the surrounding counties with. So I'm just a bit confused about that.
The statute makes it different.
Yeah, I think that's true. In the airport board, for example, there's an intergovernmental agreement that governs the membership.
Why couldn't you have an interlocal agreement in this particular situation?
You might be able to. That would be.
Well,
worth
that's what we
exploring.
had, Commissioner Edmund. We had it in the previous contracts. I don't understand why it was taken out either.
I find it really amazing, like Chuck says, this is the start of the 16th year of our contract with Leelanau County. And I'd either, before we approve anything, I'd like another legal opinion, or I would like a resolution to an interlocal agreement that would allow Leelanau County to have some representation.
Well, I'm inclined to think that, by us providing the service and, with our volume and scale, we provide it cheaper and more efficiently than it would be if each one of us had separates, because, if I recall your caseload, Leelanau County's is I don't remember what the percentage is, but it's not
12 to 14%.
It's not a huge part of our workload, although, because of our size of our department, we're very efficient at it, and we do a good job with it. And, it makes sense for them to contract with us to do it rather than try to do it on their own. So, I don't understand why this change in the interlocal agreement. I certainly don't understand that. Ross?
Well, obviously they have a contract with us and we're providing the service, and we've offered them a place on the board, and now we find out that maybe that's a technical violation of state law. And I don't know, is Leelanau County really unhappy about the idea that they're going to lose their board member, or?
I've only spoke with Mr. Klein at this point in time. We're a little bit behind. We started doing this in January, and we're into September now, so we're a little bit behind on it. He is. I will be updating him after this meeting what direction you're headed with it. But
you haven't had any discussions with Commissioner Schmuck?
No, I have not. No.
Right. It's unfortunate. It seems like they ought to have a place at the table, but on the other hand, I don't think we can sit here and violate state law, so maybe we need to, do something about it in Lansing, or try to do something about it in Lansing.
Dennis?
I'll suggest something a little different now. Perhaps I could go back and have Bob watch this meeting, and talk with Al and Bob and see if they can come up with some other solution, and I'll talk with both of them and see if we can bring this back. Either I'll bring back another solution along with an attorney at Ways and Means, or I'll bring back the attorney at Ways and Means so you can talk to them some more. Does that make sense?
Yeah, it does. So do we need to
I think we can just
table it, or?
Why wouldn't, this agreement is for, if we agree to it, Leelanau, this still has to go before Leelanau County, correct?
That's correct.
I mean, we could agree to it, and if they don't have a problem with it, then fine, they could appoint a liaison, and that would be the situation. They subcontract for our services, and we have a liaison position. It's not that unheard of or that odd of a thing. It's just adhering to the statute. And if we approve it and they have an issue with it, well, then we can look at some different ways to address it, as Dennis has mentioned. But why not at least approve it for their consideration?
If I may, Mr. Chairman, I would agree with Commissioner Friend.
Okay. Larry?
I don't see anything wrong than just referring this to either Administration Committee next week or Ways and Means, and we'll just deal with it by the end of the month. I mean, I don't see a rush to approve it today, and if we can get some further information or another way to do it before the end of the month, that would be fine with me.
I mean, I don't really know how you're going to get an attorney to change their opinion. If you read the statute, it's pretty straightforward, and I don't think they're trying to, I mean, they're just interpreting it.
Make your motion.
I would move to approve the Veterans Affairs Leelanau County Agreement for Services.
Support.
Motion by Friend, supported by Thomas, to approve the contract as provided.
I just got one question.
Bruce?
The contract's not in place, is there any fallout? Is something slows down, is anything not move forward?
Well, we've been providing them services, of course, for 2010, and that this contract covers 2010. One minor adjustment we made was to extend it to a 3-year contract instead of an annual renewal. So we've already been providing them services since January, and if this is approved or adjusted, amended, whatever, then we'd have 3 years in place. It just became a little bit cumbersome to redo it every year.
Sure. Okay.
Commissioner Inman?
Technically, I don't have a problem with the motion, but I still want, I guess, our time with Bob or an evaluation by Al, if there's, another way that we can view this thing.
We can still look at different options that would make something more acceptable to Leelanau County or even other counties who might join our Veterans Affairs Committee. We can still look at those options.
Right. That's what
I
I'd
don't
like
know
to do.
that there's any reason to hold this up.
Recall that all actions taken by this committee will be reviewed and voted on and ratified by the Board of Commissioners at the end of the month.
I mean, part of the problem is we don't even know if Leelanau County has a problem with this.
Right.
I'm not sure that, if, their representative is only a liaison to the board instead of a member of the board. I mean, Larry, you're a liaison to the board yourself? You're not actually a voting member?
No, I've been a voting member, I've been voting, and so has Schmuckel and the other 5.
Oh, okay.
But I have
And I
been
find it
informed he
simply
can't
amazing
anymore.
that this could go on for 15 years, and all of a sudden, we have an opinion that it's perhaps illegal. I would still like a second opinion from an outside source or someplace.
It happens, I mean.
All right, we have a motion on the floor. Let's vote on the motion. I think we'll do a roll call vote, please, Bonnie.
Commissioner Thomas?
Yes.
Richardson?
Yes.
Stepka?
Yes.
Friend?
Yes.
Inman?
Yes.
Hooper?
Yes.
Fleece?
No, for the reasons I stated.
Max Bauer?
Yes.
Wheelock?
Yes, ma'am. Motion carries 8-1. Ross?
I had another question for Chuck. Absolutely. Mostly, my question was about the day every week that one of your service officers spends in Leelanau County.
Yes.
Does he deal mostly with walk-ins, or are those
No.
appointments set up in advance?
Both. He gets his fair share of walk-ins, but he goes out there. Joe Meredith, our case manager, handles Leelanau County on Tuesdays during their normal business hours. They have us very well set up in their new governmental center, and he goes out there with a full schedule every week.
Okay, and I assume he's as busy out there as your folks are.
A little bit busier.
Oh, really?
So, yes.
Okay. And my other question is, do you have any idea, I assume obviously you're tracking people who you're giving service to. How many of them don't live in either Grand Traverse or Leelanau County?
Of our overall
Yeah.
caseload, which is about 7,000 cases, but that is, and we've looked at that numerous times in the past. Our software, we have specialized software, just allows us to run a report. We can run Benzie, we can run Manistee, we can run anything. A year and a half ago, Manistee, which was a big part of people coming to Traverse City from Manistee, they did open their own office, and we, as a courtesy, helped to train their people. She came and spent a week in our office and shadowed us, and we got her hooked up with all the schools and everything else she needed to go to, and our workload from Manistee has, dropped almost to nothing, because they're going to Manistee and they're getting quality services.
Chuck, would you run a report for the commissioners that would show perhaps the five counties around us and then others, and then get it to me and I'll get it to all of you so you can see?
Because I assume you don't turn people away because they're not residents of Grand Traverse County, right?
No, if they have a functional service office or services in their county, we'll direct them there. We have several counties around us that don't have anything. In some cases, in those counties, Wexford is one, Benzie is one. The state of Michigan sends traveling people up here. Usually they're there twice a month, and they'll set up shop at the Michigan Works or wherever. So a couple times a month, they will have an accredited service officer from the state that will come up, and the state, of course, has cut back on their services also, so they're pretty much just targeting those counties that don't have anything. So until somebody makes those counties do what they're supposed to do, that will probably continue that way. So, and if I could I just know what the motion was again, please?
Motion was to approve the contract
contract.
as provided.
Very good.
Chuck, I would be very interested in getting, not this report just this one time, but on a monthly basis, so that we could just take a look at it.
How many non-Grand Traverse or Leelanau
Yeah,
County veterans we've
yeah.
seen for a month?
Per month, just so that because if new VA facilities open in Grand Traverse County, that certainly is
As
going...
they will be?
Yes.
In September?
That is certainly going to impact your department as veterans from surrounding counties come here for treatment and service. And I just think it would be something that I would find useful.
It's a very good thing to keep an eye on, maybe for the rest of the year, and see what we're doing. And just a caveat to that, the Vet Center across from Myers will be opening in September, so finally. So right at the end of the year. So you're right, that's going to draw people from the entire MIT region, essentially. So
The
Chuck,
report you're going to run, though, is not going to reflect what the vet center or the clinic see, so you're not going to get a true picture.
Well,
All you're going to get a picture of is what comes through Chuck's front door.
correct, and what I'm watching for is as the facility opens across from Myers, and people come from around other counties for service, they may stop in and ask our veterans
Well, put yourself
committee.
in a veteran's...
And I have no problem with it, Commissioner, really, I don't.
Put yourself in a veteran's position, and say you live in Benzie County.
Yeah.
They have 4 hours a week.
Uh-huh.
So if something arises, you know right where they head. Grand Traverse
I'm
County,
not-
Wexford,
I'm-
same thing.
The only thing that I want to see is the impact it has on our staffing. Maybe we may have to reach out to surrounding counties.
We have talked about that extensively, and that's why I so strongly object to this agreement that Cooney came up with this year, because how can we entice Benzie, Wexford, Antrim, or any of those to participate when they have absolutely no representation? Just give us your money and we'll take care of you. I don't think so, and I think Leelanau is going to have a problem with that, too.
Well, another train of my thought is if we can show surrounding counties that we are serving their veterans, perhaps they would be more receptive to joining us in a regional approach to service veterans, which may or may not be more efficient. I
Chuck and
don't
his
know.
staff have made presentation to the Board of Commissioners in other counties. Have you
But
not?
I
Yes,
think
we
this
have.
information would be helpful.
Yeah.
Larry?
I guess I have a question about requesting monthly information from a department. Has it been, Dennis, just remind me what we're doing here. Have we, in terms of the receive and file with this consent calendar, have we asked the departments to give us quarterly reports, or are they giving us monthly reports every month?
Well, it depends
And
on...
are we re-rotating them, or what are we
It
doing?
depends on the department. We've been doing the corrections every month. You've been asking for that.
Okay.
We've done different things, different ways, but, you know, I mean, at least temporarily, I don't see any problem with putting this on as requested, but what I'm going to ask Chuck to do is maybe look back 6 months so we have a baseline, Chuck, of how these other counties have impacted us, and then as we look forward, you know, we'll be able to see the impact of the new clinic on, by Myers, you know, and we'll see if there's spikes in that, and we'll provide that information to you until it's no longer useful.
Yeah, I was just curious about the directive that we've asked our departments. I mean, are some quarterly, some monthly,
Yeah.
or
Yes.
is it just a big mix, or?
It's a mix, and it's dependent on what you've asked them to do in the past. Remember when we were the Health Services Committee, we moved everybody to quarterly.
Okay.
Public Safety, the old Public Safety Committee did not do that with everyone, so it's mixed.
All right.
And I think the thing about it is, when you run that report, I don't need to know what services, just kind of how many
The numbers.
services.
That's really all I can give
want-
you anyways.
I'd like you to include in that how many Grand Traverse residents and Leelanau County residents you run too, not
yeah.
just the outside counties,
Right.
because, you know, I think we're going to see a change in those numbers also. Okay, anything further for Chuck? Thank you for coming in this morning.
Thank you.
Is there any unfinished business this morning?
No.
New business? This would be the second opportunity for public comment. Is there anyone wishing to make public comment at this time? Seeing none, any commissioner reports? Announcements. Budget meetings are scheduled September 8th, 6 to 9 p.m., September 9th, 6 to 9 p.m., and September 10th from 12 p.m. to 5 p.m. We are tentatively holding dates as needed for September 20th, 21st, and 22nd.
So Dennis, who's going to be catering lunch?
I don't know
Talked
the
about
answer.
that already. For dinner.
Well, this is an awful big budget. It's going to take us some time, and I hope everyone understands that we need to commit the time to this budget. It's not something we're going to be able to just come in and do in 1 or 2 evenings. There's a lot to do. All right, is there any purpose for a closed session?
Motion to adjourn.
Motion to adjourn?
Second.
All done.